Thanks for joining us for Issues and Answers. I'm Ian Boyne. We know you want to get your medication, you want to get your drugs when you need them. So we have the CEO of the National Health Fund. He'll be answering some questions about that, telling us about the efficiencies which are being generated at the National Health Fund and what the fund is doing to ensure that the country has adequate supplies of pharmaceuticals. We thank you for your company. Mr. Anderson, good to have you. There were a number of people who thought you weren't doing your job as well as you should when we saw that headline in the Gleaner about the shortage of IV fluids. Is that an area where you fell down on the job?
Well, in our view, the National Health Fund worked to manage what was a global shortage.
The global shortage.
And it started out in the US in January, and it was largely attributed to an extractive flu season and breakdowns in factories that manufacture IV fluids. Oh. Having heard of this situation, I am of the view that our staff worked very proactively to address it so that patients would not be affected. And we actually managed the system across several hospitals to ensure that all hospitals had stocks at all points in time.
So no hospital had run out of stocks completely?
No.
But there was a shortage. But you're saying the shortage is not due to any inefficiency
no.
in our system. It was a global shortage.
Global shortage to the extent that hospitals in the US had to put in systems to properly manage the shortage. And we did
even
likewise.
The US itself
yes.
was badly affected.
And in our case, we managed it at a micro level to the extent that when we realized that we were running very short, we actually airlifted fluids to ensure that Jamaica had adequate supply of IV fluids. Okay. Our monthly usage is about 60 to 70,000, and our supplies had been, in terms of what we get from our suppliers, had fallen to about 30,000 units per month. But with proper management, we're able to overcome the challenge and see through this very difficult period. And I think now that we're normalizing. In fact, next week we receive a shipment of 120,000 bags of IV fluids, which would significantly ease the issues faced and restore normality throughout the sector.
Yeah. Let us talk about general efficiencies being affected at the NHF. I know there's a greater emphasis now on the use of technology. Tell us how this use of technology is resulting in people being able to get their drugs when they need them.
Yes, just to say though that Cabinet has approved the takeover of public sector pharmacies by the National Health Fund, and this will result in greater efficiency across the health system. And we're using ICT, information technology, as a driver for the pharmacy service across the country. And we have started takeover at the Bustamante Hospital for Children.
And it started in April, April this year.
April 1, and already we're seeing an increase in patient numbers. We started with the hospital averaging 3,100 patients per month. We're now up to seeing over 5,000 patients per month at the Busta, with reduced waiting time thanks to the excellent staff at the Bustamante Hospital, along with the new pharmacists and other technicians that we've been
so things have improved at Bustamante since you've taken over.
And we have also taken over at Percy Junior at Port Maria Hospital, and we'll take over at Percy Junior in another few days.
So people should see significant improvements in all the hospitals now that you are in charge of the pharmacies.
The plan is to modernize the pharmacy service. Part of the issue is properly managing your inventory. And through the pharmacy management system that we'll be implementing, we'll be able to manage our inventory properly. We'll be able to account for our pharmaceuticals, and we'll be able to manage on a system-wide basis. So, for example, if there is a shortage of a drug in one parish, we'll be able to immediately identify where that drug is and move drugs around for the benefits of the health-seeking patients.
So by that careful use of information technology, by just knowing where the supply shortages are, where the demands are, you are able to to satisfy customer
Yes, we'll
customer
be able, and
requirements.
the implementation time frame is over the next 12 to 24 months. We really want to do this very well, so we're not taking any chances on rushing, but we're moving in strategically across all hospitals, working closely with the excellent staff out there to ensure that there's an orderly and efficient transition.
Good. We're going to take a break at this point. When we come back, we want to talk about the scope of the National Health Fund and the numbers of beneficiaries. We're speaking to the CEO of the National Health Fund, Everton Anderson. We take a break, but we'll be right back.
Sunday is a family day. We like cook together, talk, share ideas, and help each other. We reason about things.
We're talking drugs today. I mean, the right kind of drugs, the drugs that you need for your health, not drugs to destroy your health. The CEO of the National Health Fund, Mr. Everton Anderson, is with us. Let's talk about the scope of the NHF. I think you're about $4 billion a year budgeted organization. How many beneficiaries? How many people are you really impacting?
Right, just to say, Ian, that the NHF has tremendous impact on healthcare in Jamaica
Delineate that,
and on the population. Formed in 2003, the NHF currently has 360,000 beneficiaries for our NHF program, which covers 15 chronic illnesses.
All right. So people who have diabetes, blood pressure, heart condition, and so on, can get a card.
Yes.
And that card reduces their expenditure
on
by
medication.
almost 50%.
Yes, the average subsidy
much?
rate is about 51%.
About 51%.
So it makes medications more available for the population.
So once a person has these conditions, and it's 15 of the most common conditions, they then go to a medical practitioner
Yes.
and have it certified that they have this condition. And then they apply for a card
Yes.
and take about 4 months to get it.
No, within 7 business days,
Within
we
7
produce beneficiary cards.
So a person watching this program now,
Yes.
if tomorrow the person goes and gets certified and sends that in
Yes.
to you, to your...
Once you complete an accurate form, comes in within 7 business days, we'll be able to send out your card to you.
God, good. You're going on to delineate the benefits of the program. Yeah?
Yes, just
And the
to
scope.
also indicate that we manage a JADEP program, which has some 200...
It's the drugs for the elderly.
Yes,
Drugs for the elderly.
which has some 250,000 beneficiaries. Also to indicate that you mentioned benefit, the actual benefit to the population is that for NHF, for last year, we actually approved 3.5 million claims at a cost of $3.4 billion.
But 3.5 million claims?
Yes, were approved last year,
At the
just
cost-
for NHF.
Just for NHF?
And for JADEP, over 400,000 claims were approved.
Wow.
Yes.
So you're impacting a lot of lives.
Yes.
And saving people enormous sums of money.
Right.
Yeah. But people have had complaints, Mr. Anderson, about availability. You know, they go to the pharmacy, they go to the drugstore, and they can't get the drugs. I know you would have touched on some of that earlier, but what assurance you can give to these persons?
Well, part of the takeover of pharmacy services is to improve the management of pharmaceuticals. Right now, we're managing by a facility with system-wide management in terms of looking at where your inventory is located, moving around stock. We expect to improve drug availability across all hospitals in the country. And as I mentioned before, it's a phased takeover, but within 12 to 24 months, depending on other issues, we'll be able to take over all pharmacies and also deliver service, not only in the hospitals, but in health centers. So pharmacy services will be more available, and also we expect to have more drugs available.
Yes. In the area of procurement, is there any particular methodology by which you are able to get more reasonably priced
Yes.
pharmaceuticals into the country. I mean,
Right.
are you working assiduously in that area to be able to source and to use your procurement skills to be able to get reasonably priced?
Yes, just to indicate, we have a very competitive 2-year tender process, which not only focuses on price, but on quality, because with pharmaceuticals, you would want to get not only the best
That's
price,
right,
but the
yes,
best
that's
quality.
right.
And we believe we've been able to get very good prices following this tender methodology, and it is reviewed from time to time. We also look at comparative prices globally to ensure that Jamaica is actually getting the best available prices.
So our procurement systems, you would say, are operating reasonably well and to the benefit of our
Definitely.
of our citizens. What other initiatives the NHF is contemplating to be able to improve its service to the Jamaican people?
Right.
What are the
Well,
things you're looking at now?
Well, we continually monitor our individual benefits program, which is what the medication subsidy is about. Apart from taking over the pharmacy services, you would know that in 2011, the activities at HCL were taken over.
It's a health corporation.
Right. So right now, the entire chain from procurement right through the medication getting to the patient is controlled by the NHF. So by managing this, I think we'll deliver an excellent service to the Jamaican public. In addition, our institutional benefits program provides capital support to public and private sector, mainly public hospitals and health centers, in terms of improving the infrastructure. So we have provided significant funding annually to our public health system in terms of capital, equipment, and upgrading facilities.
So it's not just pharmaceuticals
No.
that you support.
No.
You support actual infrastructure, machinery
Yes.
for the health sector.
Yes.
Good. Thank you so much,
Thank
Mr.
you.
Everton Anderson, CEO of the National Health Fund, which is having a significant impact on social welfare. And you have had some difficulty in accessing drugs, the pharmaceuticals. Better days are coming. NHF is now in charge of the pharmacies in the public hospitals. Already improvements have been seen at the Bustamante, Percy Junior hospitals, and other hospitals are to be added. National Health Fund working in your interest. Next week I'll be back with some more user-friendly information. Until then, Ian Boyne wishing you a pleasant day.